RSV, Respiratory Syncytial Virus, a mouthful of a name. RSV has burst into the news over the last 2 years. Why? RSV is an old virus. However, during the pandemic, around 2020 and 2021, there were hardly any cases as everyone took precautions to avoid infections. With the end of the pandemic, there has been a rebound of cases, and winter has now become a time of the triple threat, with RSV, COVID-19, and the flu all in the air at the same time. RSV is very contagious. It spreads easily from person to person in the fall and winter. Now, we're in January, the peak of the RSV season. It is common to get RSV, and almost all children will get it before they turn 2. And for most children, it feels like the common cold or the flu, and it will pass uneventfully. However, some infants and older adults could be at increased risk of a more severe infection. As a busy parent, does RSV need to be on your radar? Is there anything you can do to protect your children? What about vaccination? You may have heard many sides of the vaccination debate. Let's get some answers. Welcome to Beyond the Stethoscope, UCR Health's podcast series on health and wellness. I'm Dr. Naveen Raja, Chief Medical Officer of UCR Health and Professor of Medicine at the University of California, Riverside School of Medicine. UCR Health's physicians and healthcare professionals are dedicated to supporting the health and well-being of the people who live and work in the communities we serve. Join me now for a real talk with my great colleague, Dr. Tejal Khandhar, an assistant clinical professor of pediatrics at the University of California, Riverside School of Medicine. Dr. Khandhar is a practicing pediatrician and sees patients at UCR Health. She's also a wonderful teacher and has a passion to teach medical students and to mentor them in becoming great future doctors. Dr. Khandhar, welcome to Beyond the Stethoscope. We are delighted to have you join us to speak about RSV, especially as we are in the middle of winter and it's on the minds of parents and caregivers.
Thank you for having me today. I appreciate it.
Dr. Khandhar, what are the things parents need to be aware of during the winter season?
Yeah, sure. I mean, in the winter season for kids, as we enter December, January, we start seeing the rise in the number of bugs that kids start getting. And, most commonly the flu, and then other ones like RSV, we get tummy bugs, so the vomiting and diarrhea, but we just see a real increase, especially around this time when everybody's starting to hang out during the holiday, Thanksgiving, and then Christmas. And then in California, especially around January, we see, a number of children that start getting sick, as well as parents as well. So it's important to start keeping that in mind, that we're going to see more and more sick kids over the next few weeks, unfortunately.
Yeah, it is unfortunate. It makes parents worry. And talking about worry, there's so much in the news about RSV.
Mm-hmm.
Everybody seems to be talking about it. So what do our parents need to know about RSV, and why is it important for them to know about it?
Yeah, RSV is a wintertime bug that we see. And in California, again, we see the number of cases of this respiratory syncytial virus. It's a virus that starts spreading in California, especially around December, and really starts peaking in January, again, after we've all traveled for the holidays and we've hung out as families. And the reason we bring so much attention to RSV is it really affects our youngest children, less than 2 years old. And we just see so many cases. By the time kids are 2 years old, over 90% of them have already been in contact with RSV. While most kids will get mild symptoms, runny nose, cough, there are kids that will get much sicker, and we want to protect them the best we can. So it tends to hospitalize a lot of kids too. So it's one of the reasons that we'd like to bring as much awareness and attention to it as we can, so we can reduce the number of infections and kids that get sick, miss school, get put in the hospital. And this year, we are excited because we have a great prevention that we can offer our families now that we really haven't been able to in the last few years. So that's another reason people might be hearing more about it now.
Yeah, that's a good point. Most kids might do well, but parents, as you know, worry, and they might be worried about their child getting a severe form of it and ending up in the hospital. So, how can you started to talk about it just now? But what are things that parents can do to prevent RSV?
Some of the things that are common sense, trying to reduce infections by washing your hands, especially after the pandemic. I feel like we have more awareness of how effective washing your hands is. Trying to, re, bring especially our very young kids less often into large crowds. So the more we do that, the less they're going to get infected. Many of us as working parents, especially myself included, we have to go to work. So we have to send our kids to school and daycare and things like that. So that might be some of the unavoidable places that we send our kids. But the places that we can avoid it, where there are large crowds, where we can wash our hands, and then staying on top of our vaccines with our kids would be a great additional way to prevent these infections that can harm them. Now, some of the viruses we don't have vaccines for, like our common cold one, but flu, RSV, we have great ways to prevent kids from getting it all together. And that's one of the best ways and most powerful ways that we can keep our children healthy and safe through this cold and flu season.
Let's talk about this a little bit. Can't kids get this from touching doorknobs or touching countertops?
Not so much. Most viruses won't live that long on surfaces like that. So the more common way they get it is from wiping their nose and then playing with other kids, coughing, and just being in physical contact with other children or anybody else who's sick. Less often from like doorknobs and surfaces like that. Really, viruses can't live too long on those things. It's important to keep those things clean, but we also want to be sensible. Overly sterilizing areas can actually also do harm. Some good bacteria we all need in order to fight certain infections. Actually, they can be helpful, but the main way things spread are through runny nose, coughs, being around other sick people, and not as much from being touching surfaces like doorknobs and like countertops, desks. It's just not spread that easily that way.
Well, that's good to hear
Yes.
because they seem to be touching everything.
Yeah, they do.
Um,
Their kids are having fun, as they should be.
Kids always seem to be sneezing or sniffling. How can a parent tell if a kid has RSV?
Yeah, I mean, it's hard when you have your child for the first time, especially in school or daycare. They can get up to 10 coughs and colds and viruses a year, and that is nearly once a month, which is really tough to see kids sick like that. And so frequently, it's tough on us if we're working because we have to go get the kids as soon as the school calls, we have to go get them. And it's really hard on the children and on the families to get sick so often, but it's not unusual, sadly. They go to school for the first year, they tend to pick up all those viruses, and then in the long run, it's good for them. They build this great immune system. It actually happens to teachers and pediatricians too. That first year we're working, we get all those infections again, and then we build up that immunity. So our immune system does remember, as does children's. RSV will look so much like a common cold initially, and it might the whole time actually look like a common cold. So you'll get runny nose, a little bit of coughing, maybe a low-grade fever. It can be hard for pediatricians, your own doctor, to distinguish whether it's RSV or the common cold. The ones that get sicker, sometimes we're able to start telling, okay, this looks more like RSV. So if your child is breathing fast, you may hear even something called wheezing, which is this like high-pitched sound that you hear children when they're coughing or breathing, they tend to get a little bit sicker than your cold. So your cold, you get your runny nose, your cough. You're not playing as much as you normally do. Us as parents, we all know that if our children are not wanting to play or wanting to sleep, that's a bad sign. So that's one way we often ask families, are they eating? Are they playing? And if they say no, we know they're getting a little bit sicker. Everybody can feel a little down with the common cold, but with the RSV, you tend to start getting a little bit sicker and those who will get sicker from RSV. But again, many children will get runny nose and cough from RSV virus rather than getting really, really sick.
So you're a parent yourself. What do you look for before you panic and worry about your kids? And if you're worried, what do you do?
Yeah, I have 3 kids myself and have been through those cold seasons. And my son had just been born 2 months old, and my girls had started preschool. So because they had started preschool, they were sick, and then they brought everything home to my son. So from the age of about 2 months old to 4 months old, he was sick for that whole time. And thankfully for us, he had a runny nose and cough, but he still acted himself. And that's something that many parents will hear from the question from their doctor. Are they still acting like they normally do? Acting like they normally do and not being tired. That's some of the subtle signs that you know that, like, my child is doing good. If they're still running amok in the house, they're still climbing the walls, they're still eating all the food they normally do, they're doing pretty good. If they start having the high fevers, the fast breathing, fevers more than 5 days, these are the ways I tell family. If they're not acting themselves, if they're breathing heavy and fast, which most families will pick that up quickly as a problem. They're not eating at all. They're not being themselves, or breathing fast, or high fevers that last longer than 4 to 5 days. Those are your ways to know that we're getting sicker. Most kids, if they're not feeling so good, you give them a little Tylenol or ibuprofen, and they'll start eating and playing again. That's a good sign, actually. So because our very, very sick kids, even when they get that, they're not playing and acting like they normally do. So that's my biggest way. Are you playing and are you acting like you normally do? And are you breathing comfortably?
Dr. Khandhar, you practice at UC Riverside Health. Can you tell me a little bit more about your practice?
Yes. I'm at UCR Health, University of California, Riverside Health, and now I've been practicing for 17 years. So I've been through 17 RSV or 16 RSV seasons, and some seasons are more strenuous than others. So I'm hopeful that this season we are doing better. But yes, I practice in a couple different locations here, right in Riverside.
You're an assistant professor at the University of California in Riverside. Tell me more about your faculty position.
Yeah, I have the privilege of working at our UCR medical school as well. So I work at UCR medical students with up and coming doctors, medical students. I get to speak with medical students, teach them about pediatrics, which is definitely a passion of mine. So I'm really excited for our future generation, and we're have a lot of up and coming great doctors right here in Riverside that'll take care of our patients in the very near future. But yes, I get to work as an assistant professor at the medical school as well.
That's wonderful. You were speaking with me earlier on what got you into medicine.
Uh-huh.
Would you mind sharing more on that?
Yeah, even as a child, I always loved science and have always been very, very curious. So was always up to some experiment or, inquiring, constantly asking questions. My father was an engineer, so he loved that we did. And we asked a lot of questions, and he taught us about science. And as I started getting older, I started realizing that my mother was a homemaker, but she loved babies and loved kids. And she always was babysitting somebody, whether it was a 6-month-old baby or a 3-year-old child or a 10-year-old. And so there was always children in our house that she was taking care of, and I was helping her. So in between classes and homework and all that, I got the privilege of helping her out and spending time with these children. And so as I got into college and started really taking all my science classes, and then decided I wanted to move on to go become a doctor and go into medical school, that's when I started realizing that the upbringing my father gave me, and the love of science that he nurtured, combined with my mom's care and nurturing of children, just took me right down the path of pediatrics, and I haven't looked back since. So yeah, it really was intellectual curiosity combined with wanting to be silly and have fun with children, and really protect them as well, because I am really lucky and privileged to take care of these families, especially I've worked for all 17 years in the Riverside area, and we really have a wonderful community. And working with all the families has really been humbling. So I haven't looked back. I love being a pediatrician.
What do you like most about working with kids?
I really like being silly with them. You have to adjust, when you have a 6-month-old, and then you have a 2-year-old and a 3-year-old, and then somebody who's 15. You keep adjusting your personality accordingly. So when I walk in and I'm playing with my 2-year-old patient's teddy bear, I get to examine the teddy bear. I get to look in their ears, and then they feel so much better when I go over to look into their ears. They keep me young. They keep me feeling silly. They keep me laughing. And then I get to talk to the 15-year-old who's really becoming slowly a young adult. And so that's really interesting. And then I love holding a newborn baby. I mean, getting newborns in our clinic is a real treat. And I, myself, my nurse, we all love holding the newborns and being so excited for these families. But as much as I get to be silly and examine stuffed animals and run around the rooms, and I also realize what a absolute responsibility is to take care of people's children. I mean, really nothing more precious will ever come into our life than our own children. So it's a very big responsibility that we take very seriously. But yeah, we get to have a little fun while we're doing it. So I think it's a real privilege to work with kids, and anybody who works in a clinic with children. We tend to be very flexible and be able to have a lot of fun.
They say that one of the challenges of being a pediatrician is that you really have to take care of the children as well as the parents. How do you relate to both kids and parents?
Yeah, I think we turn the switches on and off, and over time you get better and better at it. So you're able to talk in sort of one way with the parents, and then switch it and get to be silly with the kids. It has helped me to be a parent a lot. I don't necessarily change what I do. I still give the same medical advice. However, when a mother or a father has come in the morning after having a child who's sick, I look at them, I say, you must be really tired, because I know how that is. When you've been up all night with a sick child and you're worried, and you haven't gotten much sleep, and then you come in at 8 in the morning, 9 in the morning with a sick child, on top of emotionally being drained and worried, you're also physically exhausted. So sometimes we just need somebody to vent to a little bit, or somebody to understand us. And I think myself, but really any pediatrician, and then the added benefit of myself having children, I can look at those parents and say, yeah, I get how I'm here to take care of you and help you out, but I'm here to take care of your children, of course. But I understand what you've gone through all night, or I understand the worry you've had over the last few weeks, and I'm so glad you came here to talk to us. Because many times nowadays we can get advice and information from the wrong places. So I welcome the families coming in, and I try my best to connect with what the parents might be going through. And being a parent myself, that I think has helped me a lot. I think that's helped me a lot. And yeah, you kind of turn the switches on and off, and as parents, we tend to do that. We may be interacting with our own family in that way, where we, the adults, we act in one way, and then you get to run off and be silly with the children. So, but yeah, after 17 years of doing it, it really is the fun part of the job.
Well, let's get back to RSV.
We talked about prevention of RSV. Can you please speak a bit about vaccines available, who can get them, and how it might help?
Yeah, I'm so excited about it. We did have the vaccine last year, but it was in just much smaller numbers. And this year we're able to, here right at UCR, all of our clinics have RSV vaccine that we're offering. And we have been able to protect many of our families so far. So we continue to encourage the families to come in with their babies, that are 8 months and less currently. And then some of our sicker children who may have medical problems up to 2 years old, they can get the RSV vaccine. In the previous years, for many years, we were able to give a vaccine, but was only reserved for those children who were very sick children or had any medical problems. But now we're able to offer it to anybody. And I'm really excited about that. So a child less than 8 months old in their first winter season, they get one vaccine and they're protected for the season. It's also a little bit different than a traditional vaccine. Most vaccines you get, and then you yourself end up over maybe a few weeks building what we call the antibodies, or the soldiers that we call that. If you see that infection, you're going to fight it right away. With the RSV vaccine, it's unique in that you get protection pretty much right away. We call it antibodies. So we're giving you your baby that protection right away. And it's one for the season and done. And there's even some studies that are showing that you might even be protected the second winter season from the one that you got. So we can give it to newborn babies, even a few days old. So it really is going to help prevent so many of our smallest babies from getting sick. And I really encourage families to come in and get it. We've been having lots of families come in, and so I'm hoping we have a much smoother winter season.
Dr. Khandhar, thank you very much for joining us. It's been a real pleasure to have you on our podcast and to hear your advice on RSV. It is helpful for parents and children as they navigate this winter with multiple infections in the air.
Thank you for listening in to Beyond the Stethoscope. This podcast was brought to you by UCR Health, the clinical enterprise of UCR School of Medicine. UCR Health is comprised of a team of physicians, specialists, and healthcare professionals. With medical offices located throughout Southern California, UCR Health is growing to meet the healthcare needs of the region, bringing innovative, compassionate medical care to the communities where we live, work, and play.